Hi, my name is Maddie, and I'm part of the research team at Penn State's Department of Dermatology, who's been studying damage in HS and why we feel like a damage outcome instrument is necessary. So damage is a huge contributor to disease burden in HS. Over 90% of patients have some degree of scarring, and those scars can cause symptoms of their own. They can also cause functional impairments and psychological sequelae. Damage instruments are also being used in a number of other diseases, some dermatologic conditions being dermatomyositis and lupus and others that we'll talk about in a moment, but also non-dermatologic conditions, for example, inflammatory bowel disease and rheumatoid arthritis. But we don't have an instrument that's specific to HS damage, which is what we'll talk about today. So we did a narrative review looking at current HS instruments that capture components of HS damage. We also looked at damage instruments used in other cutaneous diseases and also post-surgical star scales, since surgery is a common therapeutic option for active HS. We found that the current outcome measures in HS that currently capture some degree of scarring were the Hurley Staging System, the Sartorius score, and the Acne Inversa Severity Index, or the AC, which is newer. But we didn't feel like these adequately captured all of the morphologies of damage that are common in HS. Of the other damage outcome instruments we looked at for other cutaneous diseases, including dermatomyositis, bullous pemphigoid, pemphigus vulgaris, lupus, and localized scleroderma, there was some overlap with HS damage morphologies, but not enough for these to be independently used for HS. In summary, HS damage is a huge contributor to disease burden. Other damage outcome measures have been used in a variety of other cutaneous diseases that have been used in clinical trials and guidelines to assess progression and accumulation of disease damage. And this is also an opportunity in HS.